So during pregnancy, the iron needs increase. That's because the blood volume of the mom will increase by about 30% during pregnancy. During this time, it is very common that the pregnant mom may actually get iron deficiency. Iron deficiency in the mom may lead to the baby being born with a low iron level. Yeah, and the iron is actually very necessary for the growth for the infant. So the two main forms of iron to make sure that pregnant mom, you're getting enough of iron would be try to have heme iron coming from the animal sources like beef, chicken, fish, and liver. We take not too much of liver because it has very high doses of vitamin A. And another source of iron would be the non-heme iron coming from the dark green leafy vegetables, cereals fortified with iron, breads which are fortified with iron, or any other iron-enriched food. And take note, to increase absorption of the non-heme iron, you can actually take vitamin C from fruits so that your iron will be better absorbed. Yeah, try to avoid excessive tea or coffee as this will interfere with the iron absorption. So this is a picture of the meat, yeah, which we will provide you with extra iron, especially the red meats. And the 40% of pregnant ladies are actually anemic. Yeah, so especially during the first trimesters, you would need to have folic acid to prevent the neural tube defects. And also, normally, your gynecologist will prescribe you with the necessary supplements. So please follow your gynecologist's advice. For calcium, okay, during pregnancy, you would need 1,000 milligrams of calcium per day. This is to make sure that, you have enough for the bones, yeah, and basically, you can get calcium from all the dairy foods like milk, milk powders, maternal supplement, maternal milks, yeah. You can get it from cheese, you can get it from yogurt, yeah, or high calcium soya milk. Dark green leafy vegetables like spinach, broccoli also do contain calcium. Yeah, and if you are not getting enough of calcium because you have stomach discomfort, with milk intake, you could take a calcium supplement. Yeah, and calcium is also important for the mom to prevent osteoporosis. For vitamin D, you as a pregnant mom will require adequate vitamin D. Yeah, so you get it from the milk, yeah, yogurt, fortified drinks. If you're vegan, all that, maybe you might need a vitamin D supplement. Yeah, but once you go under the sun, a little bit of sun, maybe 15 minutes a day. Yeah, so this is not talking about the 12 noon sunlight. Okay, so it just some incidental light. Yeah, maybe 10, 9 o'clock. Yeah, and then vitamin D is very important because it will help you to absorb calcium. Yeah, so it is also very important for the respiratory function to prevent upper respiratory tract infections and also to aid in anti-inflammation, yeah, so that you would not be getting more complications from any respiratory infections. So you see the sunlight picture, okay? For zinc, you would actually require about 11 milligrams of zinc per day, and you can obtain it from the oysters, seafood. Yeah, so you see here is actually a lot, right? Okay, and then you can get it from also prawns, yeah. Okay, so I actually chose specially the all up picture because it is, besides being rich in zinc, it also has quite a lot of oil, right? Okay, so we do allow, but make sure that, you still watch your fat intake, yeah, not too much of fried foods, so to prevent the excessive weight gain in the pregnant mommy, yeah, because excessive weight gain may lead to gestational diabetes. And red meat, chicken also does provide the pregnant mommy with zinc. Yeah, besides beans and nuts, yeah, also are really good. Zinc actually serves a role as a very good antioxidant, and is also very important in your immune response to any infection. For omega-3 fatty acids, yeah, it's very important, especially because of the DHA for the brains and the eyes, yeah. So as a lot of research has been conducted on DHA, it is found very high in high amounts in the brain, eyes, liver, and muscle. And when you have adequate DHA, you know, it's really good. Some research shows that it may be helpful to prevent preterm births, you know, or also to have a role in reduce allergy in the baby. Some good sources of DHA would be fish, for example, the salmon, you know, oily fish, seafood like prawns also do contain the omega-3 fatty acids, tuna, yeah. But we're not talking about raw tuna, okay? So it's all fully cooked, yeah. Supplements can be taken as well during pregnancy if the mommy is not able to take fish, yeah, could be vegetarian or have some intolerance to fish, yeah, and especially for the third trimester, omega-3 fatty acids are very important, yeah, and it plays a role in the nerves, yeah, and you do want to make sure that the nerves are all functioning well. For probiotics, definitely it is good for the pregnant mommy to have a good mix of probiotics, yeah, and what is the probiotics? You know, it is actually live bacteria in your gut, yeah, and some of them could be lactobacillus or bifidobacterium. It does show that there are a lot of research that microbiome plays a role in the immune function, you know, of the body. Yeah, and you can get your probiotics from fermented foods, you know, for example, yogurt. It's found in some fortified maternal milks as well. Then you have all these other things which is like kefir or other things which are fermented. They do provide you with probiotics. Probiotics actually plays a role in prevention of allergy, yeah, and also very important because there could be some interaction between the gut and the brain. So your gut may be actually going to influence what's happening in the brain.